16%.
That's great. That's great.
So just in a short period of time, there's been a tremendous reduction in infant mortality. The biggest adverse contributor for black life expectancy is heart disease, and that makes up 1 full year of the 3.8-year difference. And the second is cancer, which is 8 months.
Okay.
So it's interesting that someone brings up life expectancy and what's to do. Jack is at 85 doing better than average, but on these numbers are average numbers, so you'd expect half the people to do better, half the people to do less good. But Jack has a chance to do better and hopefully have effective treatment, like we spoke about before.
Yeah. He sounds like he's doing just fine.
I wanted to continue. We were speaking about prostate cancer and Gleason score and PSA.
Right.
So we had a caller who called in, and he was 60 years old with a Gleason 7.
Right.
And he was very curious about treatments, and I stressed to him Gleason 7 in particular, Gleason 7 and higher, the rates of being cancer-free are very different depending on what kind of treatment you choose.
Okay.
So very commonly you hear all the treatments are about the same. And actually, if you look at the statistics, that's not necessarily the case. So if that gentleman went to one of the most famous cancer surgeons and had his prostate removed for a Gleason 7 cancer, what do you think his chance of being cancer-free 5 years later? As a Gleason 7, the whole cancer is removed. What's his chance of being cancer-free 5 years later? What would you guess?
I don't know, 60%?
Yeah, very good. Actually,
Really?
66%. So very, very good guess. Makes me think you're reading more than you lead us to believe. And what about 10 years after diagnosis? So if it's 66% 5 years, what do you think his chance of being cancer-free 10 years later would be?
I don't know, much less, I guess.
48%.
48.
So, yeah.
Okay.
So there's a couple of points here to make about that, and sometimes people are surprised. They think that if you remove the prostate, you're home free.
Nope.
And doctors often lead people to believe that if you remove the prostate, you're home free. It's shocking to think that you remove the prostate, you go to the best surgeon in America, or one of the best, and only 66% are cancer-free. Why do you think cancer comes back if you remove the whole prostate surgically?
Because at a Gleason 7, at some point, it got into the circulatory system, no?
Okay, now what if I told you that if we saw that same person, our data, that patient came to us with a Gleason 7, the success rate, 5-year cancer-free survival is 90%.
Wow, really?
So it means that if two groups of patients, half go to the surgeon, have 66% chance, half come to us, have 90% chance, it means that the cancer hasn't traveled before the treatment. And maybe even the surgical treatment is spreading the cancer.
Right, because when they go in there and they start cutting it up, some
and
of
manipulate
the
the
cells,
cancer. Maybe those cells, and actually there's data which we'll talk about probably in an upcoming show, how actually the cancer can spread from the surgery. So people may not want to have surgery for their prostate cancer, number one, because it can spread the cancer, and number two, there's lots of side effects or complications from the surgery, like sexual dysfunction and loss of urinary function.
Wow. Well, I don't want any of those.
We have a caller on the line. Shirley's on the line. Good morning. How are you today?
I'm okay, thank you. Just got up and heard your voice.
You're lucky. Not too many people get to wake up to my voice.
Lately, I've been getting up at about 5:55 every day.
Wow.
Yes.
So I understand you have a squamous cancer of your hand?
Of my hand, but the thing, it was not visible, even though I have a bony hand, a thin hand, no flesh, and yet it came back. I mean, I didn't even know why the doctor tested it. She tested it, and it came back from NYU, invasive. And so I had a hand surgeon who operated, and and I had tons of stitches because it was very invasive.
Aye.
And it was cleared. It was sent down to the lab periodically as he was operating, and it was all cleared. But
that's probably what's called Mohs, MOH' surgery.
It wasn't really Mohs because it was very large.
Well, you said, but there were multiple layers.
Yeah,
taken.
layers. That's correct.
Well, usually when you take multiple layers, it's usually Mohs. You take one layer at a time until the cancer is cleared.
Right. Now, I have a family relative who's a very famous pathologist, it's national, and he suggested I have a baseline done, at...
baseline what?
Of my hand.
Baseline what of your
MRI, I'm sorry, baseline MRI of my hand. Mm-hmm. And I had that done, and he said repeat it like every 6 months to make sure that it's not coming back. Now, I think it's a very rare kind of a place to find such a very large cancer.
Well, okay,
and
so
I'm just
go ahead
wondering,
and ask your question.
Yes. What'd you say?
Ask your question.
My question is, does someone like that need to have further treatment, like radiation?
Well, possibly. We would want to look at the pathology, and we treat a lot of skin cancers. I treat a lot of skin cancers over the years because surgery is often very deforming, and obviously skin cancers are occurring in sun-exposed areas of the body, like the face, nose, eyes, ears, mouth, and surgery in those areas can be very, very, very deforming. The hands are obviously sun-exposed. They're not as sun-exposed as the face, but we often treat people with skin cancers in place of surgery or when surgery fails to remove all the cells. So we would want to look at the pathology reports and speak to the pathologist. I think your family member is accurate about getting a baseline scan, but most of the cancers come back on the skin area itself. So our treatments, we use what's called radiosurgery, which is very focused. We just try to hit the cancer without hurting healthy tissues. And we have about a 90% success rate in treating skin cancers without surgery. So yes, you need to be followed. You need someone to check out your pathology, and you need a great clinician to go. This is the end of the show. Thanks for listening, and tune in tonight at 9 p.m. and next week at 6 a.m. Thank you very much.
For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive outpatient cancer treatment choices. First in America, first in New York, first for you. Radiosurgery Cancer Treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment choice for you, even if chemo, radiation, or surgery didn't work. Most insurances, Medicare, Medicaid accepted. Hyperthermia 2. Tune in our new WOR radio program Sunday morning 6 to 7 a.m. and Sunday evenings 9 to 10 p.m. To hit the cancer, call me at 212-CHOICES. 212 Choices. Super convenient, 38th and Broadway in Manhattan. Call me at 212 Choices. That's 212 Choices to hit the cancer.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212 Choices. That's 212-246-4237. That's 212-246-4237. Till next week.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed. New York. New York's only local news talk station. 710 WOR. New York.
The following is a paid program sponsored by Christian Science.
Welcome to this week's radio edition of the Christian Science Sentinel. We hope you find inspiration and healing today from the ideas shared in this rebroadcast.
Welcome to the Christian Science Sentinel Radio Edition. Thank you for joining us. I'm Steve Carlson. It can be all too easy to let feelings of frustration, resentment, or anger take over when another person's behavior or some circumstance seems unfair. Yet there's another kind of response that can serve as a powerful remedy for whatever may be troubling you. It's in line with Jesus' teaching to love God with all our heart, soul, and mind, and our neighbors ourselves. It has to do with rejecting the impulsion to react angrily and instead yielding to an abiding trust in the divine law of love to rectify the situation. God's love is more than sufficient to care for every need, and striving to express something of that love in our view of another can do more to restore harmony than we might have imagined. It can even open the way to physical healing. Our guests today talk about this, and they share experiences. They spoke with Sentinel Radio's Rita Politan and Don Hauge.
On the phone with me is Scott Putnam, a Christian Science practitioner and teacher. I'm so glad you're with us today, Scott.
Thanks for inviting me, Rita.
You know, we're talking about one of my favorite topics today, and that's the topic of love. And in particular, we're talking about God's law of love. And that's what I want to explore. So, Scott, what is God's law of love, and what effect can it have in our daily lives?
It has a tremendous effect in our daily life, Rita. And the Master Christian, Christ Jesus, says, "Thou shalt love the Lord thy God with all thy heart, and with all thy soul, and with all thy mind, and with all thy strength." This is the first commandment. The second is like, namely this: "Thou shalt love thy neighbor as thyself." There was none other commandment greater than these. Well, as I read this command of Jesus to love God and to love our neighbor, I asked myself, what is God that he should command our affection? And I thought of the sun. What does the sun do? Well, it radiates light and warmth to the physical world. And so spiritually, God emits all this love and life and light and harmony to his creation. For the Bible even says that God is love. And that love is the nearest sense of life, a sense of God that I have. So that's my sense of who God is and what he does. And I particularly like a story in the Bible about Elisha at Dothan. He was a great prophet of the Old Testament, and he was surrounded by the Syrians who'd come out and wanted to silence this